Everyone, welcome back to our channel Nursing Verse K. Today we will discuss about the most important MCQ for NORCET and other nursing exam. Topic is hypertension. Let's start. First question. A patient has blood pressure of 150 by 95 mm of Hg according to JNC 8 guidelines. This classified as the option A normal, option B elevated, option C stage 1 hypertension, option D stage 2 hypertension. The answer is option C, stage 1 hypertension. Stage 1 hypertension. Stage 1 hypertension when the BP is 140 to 159 in systolic BP, diastolic BP 90 to 90 mm of Hg, known as the stage 1 hypertension. So the answer is option C. Next, which of the following is a non-modifiable risk factor for the hypertension? Option A obesity, option B high salt intake, option C family history, option D physical inactivity. The answer is option C, family history you cannot be modified. Otherwise obesity you can modify, you can become lose your weight. High salt intake you can control the salt intake. Physical inactivity you can do the physical activity within a week, 4 to 6 hours you can do. So the answer is option C. Next, first line antihypertensive drug for the patient with diabetes and hypertension is option A beta blockers, option B ACE inhibitor, option C calcium channel blocker, option D thiazide diuretic. The answer is option B ACE inhibitor, because ACE inhibitors are the preferred in the diabetes due to renal protective effect. So the answer is option B. Next, hypertension in pregnancy after 20 weeks of gestation is termed option A chronic hypertension, option B gestational hypertension, option C preeclampsia, option D eclampsia. The answer is option B gestational hypertension, because gestational hypertension develops after 20 weeks without proteinuria. Next, in hypertensive patients reports sudden severe headache, nausea and visual disturbance. This may indicate option A hypertensive urgency, option B hypertension emergency, option C primary hypertension, option D white coated hypertension. The answer is option B hypertensive emergency. When the BP is going to 180 by 120, it is known as the hypertensive emergency, and when it will goes up, the sign will be sudden severe headache, nausea and visual disturbance. So the answer is option B. Next, which lifestyle modification is most effective for lowering body blood pressure? Option A smoking cessation, option B aerobic exercise, option C low salt diet, option D weight reduction. The answer is option D weight reduction. Weight loss of 5 to 10 kg can significantly reduce the BP. Combined lifestyle changes further help in the future. Next, target blood pressure in patient greater than 60 years without comorbidities according to JNC 8. Option A 120 by 80 less than 120 by 80 mm of Hg, less than 130 by 80 mm of Hg. Option D less than 140 by 90 mm of Hg. Option D less than 150 by 90 mm of Ag. The answer is option D. JNC recommended less than 150 by 90 mm of Ag for greater than 60 years without other condition. So the answer is option D. Next, a hypertensive patient has bilateral ankle edema. After starting a new antihypertensive, which drug is likely responsible? Option A, ACE inhibitor. Option B, beta blockers. Option C, thiazide diuretic. Option D, calcium channel blocker. The answer is option D, calcium channel blocker, because dihydropyridine calcium channel blockers can cause the peripheral edema. So the answer is option D. Next, secondary hypertension is most commonly caused by option A, diabetes mellitus. Option B, chronic kidney disease. Option C, obesity. Option D, smoking. The answer is option B, chronic kidney disease. Chronic kidney disease and renal artery stenosis are common cause of secondary hypertension. Next, the most common symptom in chronic hypertension is option A, headache. Option B, chest pain. Option C, often asymptomatic. Option D, dizziness. The answer is option C, often asymptomatic. Most patients with chronic hypertension are symptomatic. It is called the silent killer. Next, which lab test is essential for evaluating secondary hypertension? Option A, blood sugar. Option B, renal function test. Option C, CBC. Option D, liver function test. The answer is option B, renal function test, because renal function assessment helps to detect the renal causes of the hypertension. Next, a hypertensive patient complains of the palpitations, sweating and episode headache. The nurse suspects primary hypertension. Option B, pheochromocytoma. Option C, hyperaldosteronism. Option D, Cushing syndrome. The answer is option B, pheochromocytoma, because classical triad of pheochromocytoma is episodic headache, sweating and the palpitation. So the answer is option B. Next, the DASH diet helps in option A, reduce the cholesterol only. Option B, controlling blood sugar. Option C, lowering blood pressure. Option D, increasing the weight. The answer is option C, lowering the blood pressure. DASH diet is rich in the fruits, vegetables, low fat dairy and reduce the BP. So the answer is option C. Next, which antihypertensive drug is contraindicated in pregnancy? Option A, methyl dopa. Option B, labetalol. Option C, ACE inhibitor. Option D, nifedipine. The answer is option C. ACE inhibitors are the teratogenic and contraindicated in the pregnancy. Next, a patient with hypertension develops dry cough after starting antihypertensive therapy. Likely drug: option A, beta blockers. Option B, ACE inhibitor. Option C, thiazide diuretic. Option D, calcium channel blocker. The answer is option B, ACE inhibitor, because dry cough is a common side effect of the ACE inhibitors. Next, which electrolyte imbalance may result from thiazide diuretics? Option A, hyperkalemia. Option B, hypokalemia. Option C, hypernatremia. Option D, hypocalcemia. The answer is option B, hypokalemia, because thiazide diuretics causes the potassium loss. It will occur the hypokalemia. So the answer is option B. Next, hypertensive urgency is defined as option A, when the BP is greater than 160 by 100 mm of Hg with the symptoms, BP greater than 180 by 120 mm of Hg without end organ damage. Option B, BP greater than 140 by 90 mm of Hg. Option D, any high BP in emergency. The answer is option B. BP greater than 180 by 120 mm of Hg without end organ damage, because urgency is severe BP elevation without acute organ damage. Next, first line drug for black patient with uncomplicated hypertension. Option A, ACE inhibitors. Option B, beta blockers. Option C, calcium channel blocker. Option D, ARB. The answer is option C, calcium channel blocker, because calcium channel blocker and the thiazides are the preferred in black patients due to better efficiency. So the answer is option C. Next, the JNC recommends follow-up for BP monitoring every 1 week. Option B, every 1 month. Option C, 3 to 6 months. Option D, 12 months. The answer is option C, 3 to 6 months. Once BP is controlled, follow-up every 3 to 6 months is sufficient. Next, complication of long-standing controlled hypertension. Option A, liver cirrhosis. Option B, myocardial infarction. Option C, osteoporosis. Option D, asthma. The answer is option B, myocardial infarction, because long-standing hypertension causes the cardiovascular complication like MI, myocardial infarction, stroke, and also it can occur the heart failure. So the answer is option B. Next, which of the following is a modifiable risk factor for the hypertension? Option A, age. Option B, gender. Option C, smoking. Option D, genetics. Age cannot be the modifiable. Gender also you can change, and smoking you can change. So the answer will be option C. Genetics also you can't. So the answer is option C. Next, which is the gold standard method to measure the blood pressure? Option A, automated digital BP monitor. Option B, aneroid sphygmomanometer. Option C, mercury sphygmomanometer. Option D, palpatory method. The answer is option C, mercury sphygmomanometer, because it is the gold standard for the accurate measurement. So the answer is option C. Next, patient teaching for the antihypertensive therapy should include option A, take all doses even if BP is normal. Option B, stop when feeling better. Option C, only take when symptomatic. Option D, double dose if missed. The answer is option A, take all doses even the BP is normal. Consistent adherence is critical to prevent the complication. Next, hypertension with the hypokalemia and metabolic alkalosis suggested option A, pheochromocytoma. Option B, Conn syndrome. Option C, Cushing syndrome. Option D, primary hypertension. The answer is option B, Conn syndrome, hyperaldosteronism, because primary hyperaldosteronism causes the sodium retention, potassium loss, and metabolic alkalosis. Next, orthostatic hypotension in a hypertensive patient is most likely caused by option A, diuretics. Option B, beta blockers. Option C, ACE inhibitor, option D CCPS. The answer is option A, diuretics, because diuretics can reduce the blood volume leading to orthostatic hypotension. Next, patient with BP 170 by 110 mm of Ag and chest pain, dyspnea and papilledema, priority nursing action is option A, oral antihypertensive at home, option B, admit to ICU for IV antihypertensive, option C, monitor BP weekly, option D, start low salt diet. The answer is option B, admit to ICU for the antihypertensive, because sign of hypertensive emergency required immediate IV therapy in the ICU. Next, which class of antihypertensive drug improves the survival post myocardial infarction? Option A, ACE inhibitor, option B, thiazide diuretic, option C, calcium channel blocker, option D, centrally acting drugs. The answer is option A, ACE inhibitors, because ACE inhibitors reduce the mortality post MI and in heart failure. So the answer is option A. Next, ambulatory blood pressure monitoring is used to, option A, confirm hypertension diagnosis, option B, detect white coat hypertension, option C, monitor therapy effectiveness, option D, all of the above. The answer is option D, all of the above, because ambulatory BP monitoring is useful for the diagnosis and management of the evaluation. Next, target BP for the diabetic patients with the diabetic ketosis, diabetes or the CKD, chronic kidney disease. Option A, less than 130 by 80 mm of Ag, option B, 140 by 90 mm of Ag, option C, less than 150 by 90 mm of Ag, option D, less than 120 by 80 mm of Ag. The answer is option A, 130 by 80 mm of Ag, because lower target BP is recommended to prevent the end organ damage. So the answer is option A. Next, most common adverse effect of beta blockers in hypertensive patients is option A, cough, option B, bradycardia, option C, hypokalemia, option D, peripheral edema. The answer is option B, bradycardia, because beta blockers can decreases the heart rate leading to bradycardia. Thank you everyone. Please like, share and subscribe our channel.